this beautiful patient presented in my practice, and she was an ex-model. Basically, one of the biggest concerns she has was the wear of the upper front teeth and the crowding in general, top and bottom. And in many ways, the ideal treatment is the orthodontic alignment, followed by adding the bits and pieces of the teeth where that needs to be corrected to make the teeth look normal shape and normal height. However, the orthodontic treatment was not an option for this patient at this stage in her life. As you can see in the initial presentation, there's a crowding of the both upper and lower arches. Interestingly enough, most patients are not concerned by the crowding of the lower arch. They're more concerned by the crowding of the upper arch. In time, they may be concerned with crowding lower arch, which was in this patient's case. But at this stage, her main concern is the upper arch. So we loosen our patients, and then we want to see what's the best treatment for them. And we treat the patients to their requirements. Not everything is an ideal. If there's a concern where the longevity of the teeth are in question, then I will make sure I stress the importance of doing certain stages. But if we can maintain biology and patients do have certain wishes that they want to have, then preserving the biology, improving aesthetics, especially in this case the upper arch, is very straightforward treatment. So the way to move forward was to initially do the diagnostic mock-up. And as you can see during the diagnostic mock-up for this patient, we established all the correct outlines for the smile, the tooth form, the tooth shape, the arch form, and the outline to complement her beautiful face. This was the basis to move forward for this patient, and we finally decided to proceed with composite veneers, because composite veneers requires almost no tooth intervention, very minimal, and we were able to produce the final smile outcome. And this lasted for a good 7.5 to 8.5 years. And with time, patient felt that she liked to correct the lower teeth, lower crowding. She was happy with the existing upper veneers. We could, in an ideal situation, remove the upper veneers and do the orthodontics, because we could, and then go back in and place new veneers. But patients said, look, I'm really happy with the upper arch. Can we just align and level the lower teeth to fit within the upper arch? Which we could. As you can see in the next few slides, how we leveled the lower arch using orthodontics. That was done very cleverly, because you really can't see the wires, etc., because it's just hidden below the lower lip line. And again, when we corrected the lower alignment of the lower arch, you can see the irregularity of the smile line. And that was corrected by using composite restorations to recreate the teeth to the original glory. In other words, to make the same tooth form and shape that makes the tooth look normal. Now, in the final few slides, you can see how we have this patient so beautiful and so graceful 10 years after the initial treatment. And look at the beautiful facial form, beautiful arch form. She's looked after herself, and she's got a family, a beautiful daughter. And it really allows me to think how planning with minimal intervention we can maximize on the aesthetic outcome for these beautiful patients.
Yes, okay. It's been a long process, but it's been totally worth it. Didn't take away any of my teeth. Yeah, no, thank you very much. You've done a fantastic job, and I couldn't be happier.
The most important thing, again, as I explained in my previous video presentations, is the diagnosis, is making you understand the possibilities, what can be done. We could place porcelain veneers for this patient, yes we could, but composite veneers were less invasive. And that's key to good aesthetics, because we are being, most importantly, the aim is to maintain biology, preserve biology. And the next stage is to improve aesthetics, which we have done and accomplished for this patient for a good 10 years and many more years to come. Because after all, diagnosis and conservation of biology will drive the aesthetic outcome, which we have created and achieved for this lovely patient. And naturally, we can achieve for you.